Hey everybody, welcome to Dental Voice Season 2 with Zyris. My name is Rolando Mia, and today I have a really special guest I'm really excited to spend some time with. The person that we're going to be hearing from is Dr. Reznick. Now, before I get into him, Dental Voice is about hearing from clinicians, understanding the perspectives that they have, understanding the issues that they're facing, how they're navigating through it, and most importantly, getting advice from them with regard to the things that they're doing specifically to overcome or deal with some of these things. So I'm especially interested in hearing that from Dr. J. So Dr. Reznick is unique. He is an oral and maxillofacial surgeon. He received his DMD from Tufts. He got his MD from USC. He did his general surgery at Huntington Memorial Hospital in Pasadena. And then he trained in oral maxillofacial surgery at Los Angeles, the USC Medical Center. So from an understanding of all of the issues related to infection control with regard to medical and dental, I will say this, Dr. J. Reznick is a badass. So I really... among other things too. So Dr. J, how are you?
Good, Ro. How you doing? How are things up in Santa Barbara?
Very well. Yeah, it was hot as all get out, but cooling down. So happy to see you.
It's cooler here in LA too. It's only like 75 and it looks like it's going to rain, but it's supposed to get up to, I think, 90. So we'll see. We'll see what happens.
So cool. So I want to jump into this because I'm really excited to hear. Looking at the experience, the education, and the knowledge that you bring to bear from the medical as well as the dental side, one of the big issues that constantly comes up is this whole issue of infection control. And it's this hierarchy of controls as well as, breaking the chain. From your perspective, what are things that dentists should really keep in mind with regard to how to, what to really put in place, what to marry, because there's a lot of speculation out there right now and nobody really knows. So what advice would you give people with regard to that based on what you know?
Well, I think one thing to understand is that as dentists, we have sort of been ahead of the curve in infection control, starting, with the AIDS crisis in the mid 80s. Before that, it was rare for dentists to wear gloves treating patients. And I had some instructors in dental school who weren't wearing gloves when I was there. And it was very difficult for them to make that transition. But now, we started learning about bloodborne pathogens. That became part of our education. And we got very good at taking universal precautions with all our patients, whether we knew if they were infected or not. With this coronavirus, things are a little different because this is not something that's transmitted by bloodborne or to a very minor extent. It's basically airborne, aerosols, fomites, droplets, on surfaces, in the air. So the whole risk becomes much higher if we don't address how to minimize the risk. And, certainly this has been an epidemic of epidemic proportions because it's basically taken over the world, or I'm saying a pandemic of epidemic proportions, because it's taken over the world in a very short time and completely changed everybody's way of doing everything. The world is upside down right now, and we're not sure when this is going to end. Currently, the numbers are trending down a little bit, at least in the U.S., but who knows what's going to happen? There may be another wave, and so it's really important that we understand how this virus can be transmitted to person, and doing everything we can, because we've got to minimize the risk when we're in our offices to our patients, to our staff, and also to yourself. You don't want to come home and get your family sick or one of your parents. So it's really critical that we understand how it's transmitted, and we are very diligent about what we do. And that's, obviously masks, gloves, but now we're adding gowns, we're adding N95, we're adding face shields, we're adding all kinds of equipment to reduce the amount of aerosols and sprays, which have been rather expensive to bring into our offices, along with air purifiers. But we have to. In order to be able to practice and survive, we've got to do these things, because without them, who knows in the next wave whether we'll be able to practice if we don't have them. So it's always best to practice defensively, and in this regard, preparing your office for, as if an Ebola patient is coming in, is almost what you got to do to reduce the spread and risk to everyone who's in your office, and then of course outside.
So you mentioned it's amazing, because up until this point we've heard, if you hadn't been doing it, you need to do it now. Right. But then all of a sudden people are being thrown all of these. Yeah. We spoke earlier, there's an actual process for actually using this. And are people actually taken through what that process is when you're dealing with and putting on, taking off PPE and all that type of stuff? As a surgeon, having spent 4 years of surgical training, we're pretty well versed in aseptic and sterile technique. We know the proper way to put on, our masks and our hair covers, our gowns and our gloves, and the proper way to take them off so we don't infect ourselves when we're taking all these things off. So it's difficult for general dentists and other specialists who haven't had this training. It's something new you have to learn, something completely foreign that's got to be learned, but it's really essential, because you want to make sure that you're protected before and during a procedure, and then again that you don't contaminate yourself taking these protective equipment off, because it definitely will have some aerosol, some splatter on it. So you got to protect yourself when you take it off. So you have to know the proper technique to both don and doff your PPE. Doff?
Yeah.
So wait, that's a technical term. Don?
That's the technical term, yeah.
And
don is to put it on, and doff is to take it off.
So it's interesting. Never heard that before. Well, because I haven't been exposed. When you look at the population of clinicians in the dental industry who don't have the surgical background, what are some of the key things that you just have to understand with regard to doffing the I guess your PPE?
Well, the biggest thing is, if you take off your gown, you have to take off your gown with your gloves on, and basically pull the gown off. Then when you have your gloves, it'd be easier to demonstrate if I had some gloves here in my studio, but you will remove, let's say, your left glove by grasping it and removing it. So you're touching a glove surface to another glove surface. And then once you have got the one glove off, which you're holding in this hand, then you take your unprotected thumb or fingers, put it underneath the glove, and pull it down. So you're basically glove to glove, non-glove to non-glove, and you take it off and you throw it right away. But the first thing that comes off is your gown, and then the gloves.
Wow,
that's that specific technique.
I love that. I think that's when you think about the chain of infection and how you break that. One of them is minimizing exposure, and you don't even really think about it, because up until this point, there really hasn't been anything as virulent as COVID. Although I don't know, hepatitis.
But again, that was bloodborne, so you knew how you got it, and
that's right.
You could still go out to dinner, you could still congregate in groups, you could still go to concerts, you could still go to dental meetings. Even more so than the flu, or for example, the SARS-1 virus was much more contained, or MERS. The Middle East respiratory syndrome virus, were much more containable than this coronavirus, SARS coronavirus 2, which is the proper name for the virus. COVID-19 is actually more the syndrome, but the virus is SARS coronavirus 2, is that it can be spread in the air. And it spread so quickly throughout the world, it really took us all by surprise. And so that was one of the issues that occurred early on, is we'd never seen anything like this before. I think it was even more rapid than the 1918, 1919 flu pandemic, because in order for it to come to the US, people came over on boats, and there weren't as many people coming over. And now with the global economy and planes flying back and forth, and it's so easy for people to move around the world. And the other thing is that, you can be completely asymptomatic. You could have contracted the coronavirus and be completely unaware, and then travel to the other side of the world or get together with your family. And all of a sudden you have now infected many, many people, and it grows exponentially, because those early days when you first get infected are actually when you're the most highest risk of transmitting the disease to someone else. That's when you're most infective.
That's amazing. The big thing that everyone is talking about, and you touched on it, are aerosols. Aerosols in public places, aerosols in even in your home, aerosols in the dental practice. What are things, because the reason I'm asking is there's this whole issue that's been thrown around about negative pressure rooms. And when you think about a negative pressure room in a surgical, in the hospital, that is all of them are negative pressure. But that's not
actually
something.
Not all of them. Not all.
Or
of
a lot of them. A lot of them. I apologize.
For orthopedics, especially hips and knees and those big joint replacements, those are always done in negative pressure rooms. But your typical procedure is done in a standard operating room. But the negative pressure, I actually installed 2 units in my 2 surgery rooms, which were not inexpensive. And we were going to actually, it's 99.99% HEPA filter with then UVC, and then we could vent it up to the roof in our building, because we're on the top floor. And we actually brought out an HVAC guy to hook all that up, and he said that the units I bought were so efficient at cleaning the air, we actually don't need to vent to the outside.
Wow.
Basically, completely pure air goes around, and I think the 2 units I got will clear 1,000 square feet per hour or something like that. So they're pretty massive. And then we got regular air purifiers throughout the rest of the office.
So wait a minute. I love the clarification. Not everything is negative pressure. So how important is this context of negative pressure in the dental practice?
Well, again, negative pressure is taking the air in a room and completely sucking it out. And then fresh air comes in from outside. So as long as you've got a really efficient means of cleaning the air. So if you've got an inline HEPA filter and UVC system in your ventilation system in your office, or you've got HEPA filters cleaning the air all over your office. The problem with UVC is it's radiation, it's ultraviolet radiation, and there are questions about having UVC radiation in your operatories or in your office, and is that dangerous? And that's why some people put them in their air duct systems. But then there's the issue of duration. It's got to be, the air has to be exposed to those UVC lights for a certain period of time in order for it to be effective for killing viruses. So the UVC is a little tougher, and that's why we went with these units where it's all in one. They're a little more expensive. They run anywhere from, I've heard, about $1,500 for an inexpensive one. The ones I put in my OR were $5,000 each, in addition to everything else. So it's been expensive getting back to work, but we had no choice.
No, yeah, well, absolutely, and everything is highlighted around eliminating that. I know you use our system. Do you believe, we've been told that our system generates negative pressure in the mouth? Do you see that, or do you feel that that's not as as a big deal. It's
Well,
more
it
about
definitely creates negative pressure within the oral cavity and reduces on aerosols, and basically, you know, you have less fluid flying around because the isolate will isolate the area, and has built-in suction. So it's really reducing the total amount of aerosol that can be generated. But it's also, yeah, it's also vacuuming away a lot. And there's, you know, there's all these other negative pressure systems that people are selling for dentistry, where there's like a little cone above the patient's face,
yeah.
and it sucks out and purifies the air. Those are also very effective. For surgery, we can't really use those because we're generally standing up in front of the patients. We have them under, you know, general anesthesia, so we have to have, you know, easy access to their whole head. But all these things that you do are effective.
So it's a
But
matter of layers that you
yeah,
need to
and
put.
then of course, you know, completely wiping down your rooms with true virucidal agents. So like the hypochloric or hypochloric acid, not hypo, or
Yeah, hypochlorite. Yeah.
or the it's a it's like a peroxide. But anyway, I can't remember everything. So having that to wipe down all your surfaces. You know, you can use bleach if you don't have anything else to wipe everything down, although it'll make your office kind of smell, even if you dilute it. But or is it carbolic acid? Anyway,
Hypochlorous is one of the ones that we've heard.
I think it's hypochlorous. Yeah. So which is basically kind of like a bleach, but a little different. So you have to wipe down all your surface, and you have to be aware that the coronavirus will remain viable on different surfaces for a different duration of time. So something like the metal, the counters in your office, it can live up to, you know, 2 to 3 days. If you've got more porous surfaces like cloth or your surgical gowns, if you know, it lasts much less time. Interestingly, copper, which is, you know, a metal, tends to be virucidal and bactericidal. So the virus tends to live much shorter times, like less than an hour on those surfaces. But, you know, we don't have a lot of copper laying around our offices unless you, you know, and you like, you know, unless you like that look. And so you just have to be diligent and wipe down before and after every patient, as well as at the beginning of the day, at the end of the day. And so we've dedicated, you know, an extra 15 minutes for every procedure we do to wipe down the rooms. And so it reduces the number of patients you can see in a day for sure. And that's another thing. Even if we, you know, our schedule's been pretty busy for the last few months, but we can't see as many patients per day because we're restricted by, you know, this extra time to clean. So instead of 30 minutes for a procedure, it's now 45, and you get a couple of those in the day. And, you know, I can do 2 less surgeries, see 2 fewer consults during the day, because we have to space patients out. We've got to make sure there's not too many people in the office at once. And it is a burden. But, you know, what choice do we have? It's either that or sit around and do nothing.
So if you were, for the clinicians, for the dentists, the other clinicians, hygienists, dental assistants, from your understanding from the surgical suite and marrying it to the dental office, what would you say are the top 1, 2, or 3 things you absolutely need to not do, or you have to do, not to forget? What would you say those would be?
Well, I think you definitely need to protect other patients that are coming into your office. So, you know, wiping down all surfaces, and having air purifiers in your consultation rooms or procedure rooms. And then protecting yourself if you're doing a procedure which generates some aerosols, which is pretty much everything we do. And that's having, you know, the N95 mask. We actually use an N95 with a level 2 on top of it because, you know how difficult PPE is to get. And so we make our N95 masks last, you know, for a couple of days by covering them with a surgical mask that we change pretty much every day. And then we have a shield on top of that, which we change like every 2 days. We wipe it down and then change it every other day. So at least that, I think having your hair covered is a good idea. Definitely having a full length gown and gloves that come up over the gown. are good to protect you, knowing the proper way to put on and take off the PPE. And what I can do is on my educational website, onlineoralsurgery.com, I've got some videos that I recorded for one of the companies I was working with, actually an implant company, to demonstrate proper aseptic technique. And I'll actually put those on the website so that anyone who goes to onlineoralsurgery.com can view those videos on donning and doffing. So I think that'll be really helpful to everybody. But and get as knowledgeable as you can. Get information from reliable sources. If you're going to get stuff off the internet, get it from reliable sources. And one source that I get to keep up on everything is a website called VuMedi, VuMedi.com. And every day they're adding lectures about anywhere from 10 to 20 minutes from epidemiologists and virologists and infectious disease experts and pulmonologists, cardiologists from all the major universities. There's a lot from Stanford, Harvard, Penn. They give you the up-to-date, up-to-the-minute, most relevant, scientifically based information and clinically based information to go by. Don't go by the news. CNN and MSNBC and Fox News, don't listen to that. But really reliable sources are really critically important. And of course, make up your own mind about what you think is the best thing to do for your office. And, I know the mask laws are different from state to state and community to community, but I think, wearing a mask, as horrible as that is, I hate wearing a mask, wearing them when you're in the appropriate circumstance. So if you're indoors, you need to wear it. If you're outdoors by yourself or with a family member and you're at least 6 feet away from others, you don't need to wear a mask outdoors because it's not going to make a difference. But definitely indoors, you need to. And when you're around other people that are not part of your family, because the three things that really dictate whether you are going to get infected or pass the infection if you're asymptomatic are dose, which is basically how infectious you are or they are at the time, the proximity to that person, and the duration that you're around them. So if you are, for example, outside walking and someone is coming at you from the other direction, who has coronavirus, they're in the early stages asymptomatic, and you just walk past them in a brief second, your risk, even if neither of you are wearing a mask, is like less than 0.05%. Okay, so it's pretty minimal because it's a very brief encounter and it's outdoors. Whereas if you are indoors with someone, let's say you're in the bank or in an office setting where it's enclosed, you don't have the fresh air constantly circulating, where you have to be within 6 feet of each other, and you're within 6 feet for about at least 5 minutes, then you have about a 0.5% chance from each of those encounters, and of course they add up, they accumulate, of catching the virus. So for example, someone in your household who you're constantly exposed to day in, day out, it's much higher, like 10%, or if you're vulnerable, even 20%. And so there are different risk factors that make you more susceptible to catching the virus and becoming sick, that you've got to consider too. So there's so many factors that you need to consider, and that's why getting real legitimate science-based, clinically based information is so critical now, because there's a lot of misinformation out there, and a lot of conspiracy theories and all that kind of stuff that we have to get past and wade through. Yeah.
It's the idea of duration. I'd heard that, but you really, a quick flyby, not as big a deal, but the longer you're together, the proximity, that's another one. And then also,
it goes up.
It makes sense. Now, when you have patients, that, I don't know, for some reason or another, they just don't believe or don't want to comply.
Yeah.
How do you deal with that? How do you manage that?
Well, you know, it's pretty busy or pretty easy from my standpoint, because my paramount responsibility in my office is to protect the patients who are there and my staff, and of course myself too, because I'm no good if I'm, you know, have to quarantine for 2 weeks, and I get sick enough that I can't practice anymore, or I'm gone for months. It's easy in Los Angeles, in California, because there's an emergency mandate from our governor and from our mayor that everyone who enters any indoor space, and especially a medical office, must wear a mask. They must have their temperature taken upon entry. They must answer a screening questionnaire before they can be seen. They've got to use a hand sanitizer. All those things are required. And so if a patient doesn't want to comply to that, you know, how do you deal with it? So first thing we do is, whenever a new or returning patient makes an appointment, we tell them that this is our office policy mandated by City of Los Angeles and by the state of California, and we're abiding by it. So expect these things when you come in. If you don't, if you can't accept those, then unfortunately we can't see you until this blows over. So, you know, if they come in and they refuse to wear a mask anyway after being told, you can refuse to see them unless it's an emergency. If it's a true emergency and there's nowhere else they can be sent, then you need to treat them, but you need to modify what you do. And so if we have a patient, I actually have one who absolutely refuses to wear a mask, will not fill out the questionnaire, won't get her temperature taken. We said, okay, well, here's what we're going to do. You have to be seen after hours when no patients are there, when I have a very minimal staff. You will need to use the hand sanitizer. You will need to complete the questionnaire. If you don't want to use our thermometer, you can bring your own, but it's got to be used in our presence. And of course, a lot of these patients will claim they have a medical condition that prevents them from wearing a mask. So what we're requiring is have your physician send us either email or regular mail directly from their office a letter stating what medical condition you have that will prevent you from wearing a mask, and why wearing a mask is detrimental to your health, for a brief visit or a 30-minute visit. And once we have that, then we'll appoint them. But they also have to follow the other rules, because again, it's not, you know, if the patient wants to get sick, that's fine. But the problem with it is that during that 2-3 day asymptomatic carrier period, you can easily infect, you know, 10, 20, 100 people without knowing it. And that's where the danger is. And that's why this pandemic has become a pandemic and so quickly.
Oh, wow. You know, I love the context that you build around it. And you either comply or you don't. We're setting these rules. You either do them or we don't.
So there's no obligation to treat them. It's not considered discrimination. And I definitely have spent a lot of time researching the legal opinions, and it is not discrimination, because you're not saying you won't see them. You're saying we'll see you as long as you follow the emergency health guidelines that have been mandated to us. And so it's not refusing to see them. So it's totally different. It has nothing to do with the Civil Rights Act of 1964 or, you know, Americans with Disabilities Act, any of that. It's basically, you're happy to see them as long as they comply with these mandates.
So I could, oh my goodness, I could spend, you have such a wealth of information. So much of it is so practical. For people who want to find more out, I love the website you have, but you do have other resources that people could go to.
Like I said, View Medi is great. And I watch a couple of videos on there pretty much every day to stay up to date on the latest. You know, the CDC issues some guidelines, but they're not hard and fast rules. The dental associations do the same. You know, one of the problems is there's no absolute guidelines that everyone are saying, do this, do this, do this, do this, don't do this. Even organizations like, you know, my organization, the American Association of Oral Maxillofacial Surgeons, came out with a position statement, and it just talked about air purification and all the options and all those things and surface disinfectant, but it didn't give recommendations. This is what you need to do. So there's not a lot of that out there. So again, you have to use all these resources to decide for yourself and your practice what is the best thing that you can do.
What makes sense. And you have onlineoralsurgery.com, which is also another educational forum that gives that has a lot. You also teach a bunch of courses too.
Mm-hmm. Yeah, I've got an implant training course that we're doing in November in Los Angeles. And actually, there's information about that on onlineoralsurgery.com. But we're actually doing live surgery on patients in Los Angeles, which is great. And part of the instruction on the first day is it's basically a class geared to novice implantologists. So basically, if you've done, let's say, less than 10 cases, or you're just getting started. And we also teach, you know, donning and doffing of PPE, how to prepare an aseptic field for doing implant surgery, as well as talking about surgical basics. Because, you know, when you're doing surgery, that's a lot different than doing a restorative dental procedure because it's invasive and a lot of times non-reversible. And so the whole standards of knowing your knowledge base when you do surgery are really critical. So, you know, I'm really kind of a, you know, it's been my campaign for the last 15, 20 years that if you are not a surgeon and you want to start doing surgical procedures, you need to learn about it the right way. You need to understand the anatomy, the physiology, know what the procedure is step by step, understand the potential complications, how to avoid them, how to manage them so that you can manage them yourself without getting help, and know which cases you should be doing or you can do and which ones you shouldn't, and you should refer to someone more experienced. So I always tell my students, when you look at a case, you don't look at it and say, you know, I think I can do that. You have to be able to say, I know I can do that based on your education, training, and experience. And if you can't say, I know that I can do it, you just don't do it. It's, you know, you're gonna get bit in the ass if you in one of these days if you don't. And it's probably sooner rather than later, and nobody wants to see that.
Huge point.
You know, we want everybody to be really successful in their practice and sleep well at night, and give their patients the best care that they can. And sometimes that means sending the patient to someone more experienced and qualified. And that's just the way life is. I mean, I don't do TMJ surgery anymore because I just never did a lot of it. And when I did, it was very sporadic. I thought, you know, I don't do enough of it to really be good at it. So, you know, I'll do the night guards and anti-inflammatories, but anything beyond that, if you don't get better, I'm going to refer you off to someone who does a lot of TMJ surgery. Same thing with, you know, nerve injuries and that kind of thing. That's cool. What you do well every day.
That's cool. And you have, you mentioned earlier before we got on, you've got a couple videos or something that you're going to make available.
I've actually got a couple podcasts that I did on my website. One of them is with Dr. Kathy Hayes, who is an epidemiologist. I believe she is head of the now Massachusetts State Dental Public Health organization, and she's got a master's in public health. She's got, I think, a doctorate in public health. She's brilliant, and you know, she's trained at Harvard and Tufts and BU and is on faculty at Harvard. So we had about an hour or so talk about, you know, COVID-19 and this new virus and what was known, you know, at the time a couple of months ago. And then I've got another podcast that's with Dr. Sam Elabraji, who is a prosthodontist up in Portland, and he is very well versed in how you modify what you do in your practice and what to do in this new age of COVID-19. So they're both really great talks, and so I'll make them available on the website so that all you need to do is register get the 30-day free trial, and you'll be able to watch those videos. So they're a really good supplement to what we talked about today.
Cool. So first of all, I so appreciate you spending time. If people wanted to get in touch with you or ask you questions or wanted to visit, what would be the best way for them to do that?
Oh, probably the best way is to just send me an email, and my email address is jay at onlineoralsurgery.com, all one word, and it will go to me directly, and I'll answer you.
Awesome. And
obviously, I'm always happy to help. I've been teaching non-surgeons to do surgical procedures for about the past 15 to 20 years, and I enjoy it. And again, my mission is that you learn it the right way, cool. Or don't learn it at all, don't do it at all.
Yeah, so, and you've got onlineoralsurgery.com, so that's pretty cool. I love the wealth of information you have. I really appreciate that you're willing to share it. I also have discovered that you are a horologist.
How dare you call me that?
Hold on.
Yeah, kind of an amateur, watch collector. I love mechanical watches. I probably have way too many. Yeah. I've actually thinned out the herd lately because I realized I don't need 60 watches, which for some collectors that's nothing.
You do.
So I kind of weaned it down to about 20 that I like. And of course, then the biggest problem every day is what watch do I wear? Yeah. And God forbid I should wear the same watch 2 days in a row. But that's fine. I really like the mechanics, and just, it all started when I was, I think, 16. My grandfather gave me his Gruen Curvex as one of my gifts when I turned 16. And I loved it. And I subsequently have got 2 other of his watches. And I actually, when my son turned 16, in addition to the car he got my grandfather's watch. So he's got his great grandfather's watch that's from I think from the 50s or 60s that will be his to pass on to hopefully his son down the road.
That is so cool. First, hey, thank you so much for joining us, and thank you for that. At some point here,
it's always great to talk to you and see you.
Yeah. Things are going to evolve. More and more is going to happen. Would you be willing to join us in the next several months again in our next season? And then this way we can share and kind of continue the dialogue around what's real.
Absolutely, because what we say today may be completely irrelevant in 3-4 months.
Right, as we learn, and that's it. So, hey, those of you who are going to be watching this, there is so much information. Dr. Reznick has been on a whole host of other shows. Just recently, he had a wonderful podcast with Howard Fran on
we talked for an hour and 45 minutes.
and he's got
Howard's an old friend too. And we just talked about everything.
No, it's awesome. And then there are also the videos on online oral surgery. Yeah. If you like this content, please share it. Please reach out to Dr. Reznick and, take advantage of the information that he has there. Onlineoralsurgery.com, online oral surgery. And there are a bunch of courses out there. Dr. Reznick, thank you so much for joining us.
You're welcome. Let's do this again for sure.
Yeah, and we could get into all sorts of things, and maybe you can share more donning and doffing. I love it. Okay. I love it. I learned something.
I'll make those videos available on the website.
Awesome. All right. Hey, thank you. Have a great, safe rest of your week. Look forward to talking to you again, and thank you for joining us.
We'll see you again soon.